in your handout, we're going to start with lice and scabies because to me they're easier to start with.
Dr. O'Shaughnessy, do you take shots?
Or just for your mixture?
In my younger age, I did do that. But now that I really require on my brain to be my living, I don't do that very often.
Did you strictly recommended one per day for women?
Yeah. Okay, so lice. So you talked about lice and scabies. Okay. So this is the time of the year, if you were working in family medicine, pediatrics, where you would start to see this. As soon as kids go back to school, that's when lice will usually start going up. I used to get in the pharmacy because I worked in several places. I worked were in the rural areas, and they would invariably, the mom would come in and go, "Look at her head, she's got lice." So I think she has lice. So when it says in here that they don't jump, I just never believed that. So I used to see a lot of it in the pharmacy because moms would come in and say, "Is that what that is?" So you know kids are usually sent home from school when they have lice. I don't know what the policy is in Oklahoma City. If you all know, that would be helpful. The American Academy of Pediatrics says send them back after a day. That if you've treated them, then they can go back. I read that some schools have a no-knit policy, which means all knits have to be gone. But that probably is just overdoing it. And that can keep kids out of school for a week or so. Any of the rural areas, April, do you know?
I think they get sent home, and I don't know
how long they make them stay up?
I don't know. My boys have never had it, but you know they have short hair, so I don't know if that has played a part.
Yeah, don't know.
I would know. I'll know when they get it.
Ours, they don't send them home.
What?
Oh, yeah.
Oh.
My daughter actually got it because of that.
Wow.
Yeah.
When I was in Austin, there were little schools around us that got shut down like for a week because.
Yeah, they just sent home a note. That's it.
Wow.
Yeah.
Okay. Great. Okay, so we're going to start with treatment. Okay, so when you look at treatment, if you look at that first page under pediculicides, when it says pediculicide, what it means is that it will kill the adult. Okay, so all of them will kill the adult. If you cannot get rid of an infestation or they keep coming back, then you might want to think of those that will also kill eggs. They are the more potent and they have the more side effects, and I'll point that out as we go through. So you have the pyrethroids, those are over the counter like Rid. You have Malathion, which is, you go look in your garden, tool shed. It's a common organophosphate. We use it to kill other insects. Benzyl alcohol, spinosad or natroba, or topical ivermectin. Okay, so those are the products we have. So again, they all kill the adult, but not all of them kill the egg. Usually they're all going to be topical for the most part. Shampoos, things that you put on the head. We do have a topical. Ivermectin codes as a topical. So if we get widespread outbreaks, it was one of the prescriptions I gave you, and it's just impossible in a nursing home to treat everybody. They could use a topical. They could use an oral. Usually, and the other thing to look at in distinguishing them is, because they all work, they're all neurotoxic to some degree, is how often do you have to give it. So the more potent, you might get away with one, but usually you're going to treat them. That kills the adults on the hair. And then when the eggs emerge in 7 days, usually you have to retreat at some point around there. Okay, so if you look at this life cycle, did they show you something like this? Okay, so you'll see that they only live about a month, but they become mature within a week and they can start laying eggs. And it takes those eggs about a week. Is it a week to come They emerge after 6 to 7 days. So that's when they're likely to show up again. So in the past, schools that had no knit policies, sometimes the kids would be out for that length of time. So those are the things to pay attention as we go through. Okay, so in general, just in the very middle, in terms of application, I've given you, I think, 2 links to different YouTubes that show you how it's applied. If you've never seen it before and you want to familiarize yourself, you can. So hair conditioners, things that are on, you want to get good contact with the hair because you've got those nits that are attached to the hair shaft, right? That's where the female lays it. She cements them on with lice spit. Rinsing these topicals, you want to do it in a sink instead of over the body, so we tell them don't get in the shower, put your head under a faucet, let it rinse it that way. The other is to use warm water, not hot water. So if you vasodilate, you can absorb more of this. Most of these, like the permethrins or the permethroids, are fairly low toxicity to humans. But some of these are high toxicity. So we would like to not absorb it, especially with kids. Lindane, which used to be a product that was fairly common, is no longer recommended. It's just too neurotoxic. And kids have died from too much exposure. So like with everything, we keep killing off the ones that are susceptible, and the ones that aren't live on. So there's resistance now to the pyrethroid. So if you're in an area where that is the problem, then those ones at the top, permethrin and the permethrins, they may not be any longer as effective. We're going to approach it with low resistance and go through how to use it. So the pyrethroids are usually the drug of choice. They're inexpensive. You can tell them go to the pharmacy, pick it up, and follow the instructions. They've been used a long time. Oh, I have pictures. Forgot. So there's the little nits. They probably showed you these. Sometimes I find them hard to see. And that's on her little hair, whatever's holding her hair together. You can see the scoriations though, so when they're scratching. And there's the rid. So the rid comes with a kit. So the kit has the little special comb in it that they can use to comb out the nits and the lotion. And some of them will have sprays in them also that you can spray, like the furniture or the bed sheets. Everything they're come in contact needs to be washed. Clothes, everything. But if they are have been laying on a cloth covered furniture, you can spray and also treat them. These are made from chrysanthemum extracts. Okay. So some people have allergies to chrysanthemums. I didn't know that. But it's very related to the ragweed. So chrysanthemums, ragweeds are cousins. So if people have strong ragweed, they may have reactions to these products. I'm not sure how people get exposed to chrysanthemum. The only thing I could think of is tea. You can get chrysanthemum tea, but I don't know how else you would get exposure, I guess smelling them. You know, you all probably didn't do this. Now I realize there's a real generation gap between us. That, you know, homecoming, when I smell chrysanthemums, it's homecoming. So I don't know if you all did that. Do you all still do homecoming? You still get corsages? They still do that, okay. They're not real. Chrysanthemums are what?
Well, no, like the ones now, they're not.
They don't do that?
How about real?
Some work. Okay, so some do, like a silk? A silk?
Yeah.
They don't, you all don't do it? They don't do it either?
Yeah.
They're so fun. Okay, so keep that in mind. So ragweed's very common. It's all over the place now, so people will start having symptoms. Okay, so administration, so it's applied to a dry hair. It's left on for only 10 minutes. You want to make sure it gets really down on the scalp, because some of the adults will be on the scalp. And you saw where they're biting, and that's what makes them very itchy. The second, for the permethrins on the next page, the second treatment is on day 9. So that allows those eggs to hatch. So you can take it that the pyrethroids are just pediculocyte. So they only kill the adults. And it shows you there the rate. So you still have a good % of people who could be treated, even appropriately, and still have nits. If you look back on the very top of the first page, under permethrin, it comes as a 5% cream and lotion, which is prescription, you would have to write, and the 1% is over the counter. However, they are deemed to be pretty much equally effective. So there really isn't a reason to use the 5%, but it's out there. So precautions, low toxicity, ragweed allergy, keep in mind, allergic to chrysanthemums. This one's important. Age is important because some of these we can use in babies, some of them we can only use in older kids. So the pyrethrins, okay, so pyrethroids come as pyrethrins or permethrin. So the pyrethrins can be used in kids 2 years and older. The permethrin can be used in babies. So if you got homes that are where you got older kids that have lice, the babies could get it, or you have a really unclean situation or unsanitary, then kids, babies may get it. Questions about those? All right, so let's look at the ones where are the alternatives. So this is Malathion, the benzyl alcohol, the spinosad, and Ivermectin. Here are two, so there is using rid to remove lice. There's a YouTube you can look at, and combing them out. That's why they use that special little comb. The teeth are very close together, very fine, and we'll just scrape those off. It takes a lot of work to do it, and let me show you how. Okay, so Malathion is a neurotoxin. It's very powerful. It's an organophosphate, cholinesterase. So what is it going after? Nerves, and what neurotransmitter is it affecting? Acetylcholine. Okay, so it goes off after actually the enzyme that metabolizes it, so you get too much. So it's neurotoxic, kills, very effective. We use it for a variety of insects, so it isn't just lice. So it will kill the adult and the egg. So this one is broad spectrum, very powerful. It also has an additional product in it called terpineol, which is another pediculocyte. It is flammable because of the vehicle it's in, so storage might be the problem there. So this one's different. You apply it to the scalp, but you leave it on for 8 to 12 hours, and then you wash it off. So hair has to be left uncovered. This is a problem. So you can't do it at bedtime. You have to do it during the day. Don't use a heat source because that will increase the absorption rate. Usually for one treatment will do it. So it's rare that you have to repeat it. So if you've got infestations you cannot clear up, this one is a good second one to go to. Realizing though it has a lot of side effects with it. So it does stink. Smells. Go out in your shed or your parents' shed and smell the Malathion dude. It's irritating eyes, flammable. We talked about the alcohol content. Okay, age. It's contraindicated in kids under 2. And safety data is not great under 6. And when I mean not great, it's just not a lot. So 6 and above, safe. Under 2, don't use. In the middle, you have to look at what other choices you had and what was the severity of the problem you were dealing with. Benzyl alcohol. So this one is a relatively new one. I love their picture, because it suffocates the lice. So it asphyxiates it. So the benzyl alcohol paralyzes its respiratory center. And then the vehicle they have it in, the mineral oil, smothers them. So it isn't good enough that we just let it, they can't breathe, we continue to put a pillow over their heads and it's like, die. Okay, so it's applied again to dry hair, rinsed off after 10 minutes, has to be repeated in 7 days. So that's going to be your biggest problem is that repeat. Now I think a lot of moms or dads are going to be, lice, we're going to make sure that gets done. But making sure they understand and have enough drug on hand to do that. So it can be, you can imagine, it's an alcohol, very irritating to the scalp for some people, real tender heads. So keep it out of the eyes. It can be used in 6 months and older. So here's one of your good ones to use in babies. Spinosad or Natroba is another one that's used for all kinds of insects, mosquitoes, fleas. You'll see it as an ingredient in that. So this one is ovicidal and pediculicide, so it will get both of them. Again, put all over the scalp. Hair should be, dry hair, scalp, 10 minutes. So they're all the same except for Malathion. So that's the way to remember it. It can be repeated if you're still seeing live lice. Not recommended under 6 months of age, so you can use it in babies. So your benzyl alcohol and your spinosad are the 2 that you would keep in mind. Topical ivermectin. Did I put Ivermectin? Did I? Okay, do that. Cross out that N. It's ivermectin. Splice. So this one is extremely powerful. It is a direct pediculicide, so it kills all the adults. It's called an indirect ovicide because the eggs will still hatch if they are there, but the lice that come out are usually not viable, and they will die within 2 days. So they're called indirect ovicides. Again, a very good product. It is usually a single application does it. It is expensive. And in 6 months and older. Okay, so what do you do if you've got refractory? The biggest thing is make sure they used it right. So anytime you have a product that is good, but it can be used at home, and it's complicated, it's likely that they following instructions. Can people read? Can they just follow simple, not simple, but the flow of instructions? So that's one thing. So look at adherence. What did they do? How did they do it? So if they fail to respond to one, treat them with a different one, if adherence was not the problem. The other is that you can use oral ivermectin. It is based on weight. You can't use it in children under 15 kilos, though. When it's dosed orally, it's given 2 times. So first day, 7 days later. Can't use it in pregnant women, can't use it in kids less than 15 kilograms. Be decontamination. The other thing is to tell folks, here's what else you need to do. You need to decontaminate your house or where they're sleeping. So their bedclothes need to be washed, very hot water, hot soapy water. They need to not share, the kids not sharing combs, things that could transfer lice. Keep your hands off your brother, don't touch him, that kind of stuff. Hairbrushes, combs, plastic articles can be decontaminated. So that's why that red kit is usually pretty good, because it gives you the tools all in one to do that. But you can buy them separately. Outer clothing, you may need to look at, like if it's, winter usually isn't the problem, it's usually more warmer weather. Okay. Questions about those? Next page, nice table, because it gives you all the products. At the bottom, the information is for topical ivermectin. Did I put it in there? This one? Yes? Page 11, okay. So it tells you mechanism of action. You'll see all of them are neurotoxic. They all do it in a different manner, but except for the benzyl alcohol. Tells you the age groups, gives you a summary of the regimen and what to do, and then the cautions. Really good summary. Okay. Any comments about lice? Anybody have any stories to tell? Okay. All right, scabies. When I was probably a junior in college, right before Christmas break, they shut down the university because they shut down all the dorms because there was an outbreak in one of the dorms. So they shut down all the dorms. They told us we could not go home for Christmas. So they kept us there, but they eventually, I think after 2 days, they were like, okay, you can go. And this was during finals week, so we were still all during finals, but they said, don't plan to go home because you can't go home until you're treated or you've been checked out or whatever. So that was a mess. You have never seen so many mad people. Anyway, so that was my only exposure to widespread outbreaks of these little infestations. I think they went into that dorm and burned they threw away all the mattresses. Yeah. You know how grimy those things can get over years. Okay, so scabies. What did you learn about scabies? Yeah, they are just awful. They're nasty little creatures. Poor little baby there has them under his arm, and that's sorry. Where did I do the lice? Is that all the lice I have? Scabies? It may be. Okay. All right, so for scabies, again, it's the same kind of drug. So here the permethrins are the drug of choice. So here, you're covering from head to toe. So with the lice, it's usually the head. So here it's total body. 30 grams will usually do it for an adult. You can use the permethrins on babies and children and geriatrics. But here the cream is left on for a longer period of time, 8 to 14 hours. Sometimes they require a second application. Here is where that higher percent one might be worth investing in, that 5%. For kids, you might want to put little gloves on their hands so they won't rub it off. The permethrin is considered safe in pregnancy. It's considered safe in kids. However, you can also consider topical sulfur. Have you used topical sulfur? So my dad was big into it. So when we were kids, we lived on 10 acres and we would tromp all over the place. So my dad, pharmacist, he bought bulk sulfur, he'd mix it with talc, and then he would cover us in it. We smelled. But I never got chiggers. I never got them. They kept them off. So they will keep all bugs. Ticks won't get on you. Bugs will not climb on you. I still do it now. I buy a bulk sulfur, mix it with powder, and I just cover myself when I go out. They never bother me. Yeah,
When we went camping, we would do baby oil. If you just soak
did that
it.
work?
Yeah, it really worked. I remember I used it, we went out for like 5 days, and the very last day I forgot to put it on, and I got killed. But the year before that, I went to the same place. I got cheaters, I got mosquito bites, I got ants, and then the next year I just used a lot of baby oil, and nothing touched me.
I've never done the baby oil, but the sulfur does work, and it's cheap. It does, but you know, when you're out working in the yard, in the field, who cares what you smell like? Okay, the other, with the scabies, is to use the oral ivermectin. So note the dose there. It's 200 micrograms per kilo for a single dose, and then you repeat it in 1 to 2 weeks. I believe I gave you this one. This is the one I gave you as a prescription. So this is the one that you can use in facilities where you got outbreaks. So think about your nursing homes, long-term care facilities. Not recommended in pregnant women, not in kids under 15 kilograms. So those are pretty easy. Questions about those? Hidradenitis. What'd you learn about it?
Sweat glands.
Pardon?
Yeah,
Apocrine.
Say it again.
The apocrine glands.
The sweat glands.
Oh, yes, sweat glands. Okay, so acne inversa. Why do they call it that? It's a very good descriptor. It goes in. So I saw quite a few of these in the diabetes clinic. In fact, one of the PAs that was a faculty here for a while, she and I used to share these patients. It is really difficult. When it talks about the impact on their self-image, and it's just a terrible disease to deal with, especially the more severe it is. And I think the diabetics, it was just the diabetes control was really contributing, so that's why I tended to see them more often. But it was really felt bad for these folks, a very difficult disease to deal with. So you probably saw those kinds of pictures, right? And that's pretty limited. Another one is that pilosebaceous follicle. Did they talk about that? You've been through where it's showing up? And then I think this picture is really good because it shows you those sinuses and how they can congeal and form sinus tracts. And those are really the hard ones to get to clear up. Okay, so let's look under treatment goals. One is we want to prevent new lesions. We want to get whatever lesions show up, we want them to heal very quickly and go away. And then we want to prevent those sinus tracts and nodules from developing. Did they talk about the Hurley clinical staging? Yes, okay, because that's how I organize treatment. So let's look at just general management. The impact on quality of life should be recognized. And look for depression, screen them for depression and treat if needed. So self-management is a big thing. How do you take care of those areas? Because they can be anywhere on the body. The ones I saw mostly were under the arm, but they can be in the groin area, they can be on the trunk. So how to take care of those? So you want to not aggravate those areas. So avoiding skin trauma, so things that are going to rub on them. So like loose clothing. Shear trauma you want to decrease. You want to use dressings that don't harm the skin. So that's why I put this information up there. So you want to use, you can use white petrolatum to keep your dressings from sticking. Are you familiar with these fishnet type? Yeah, elastic fishnet dressings. You can buy them over the counter. They're really nice because they will hold in place and they're very flexible. So you buy them just like that, you just slip them up. They come in a real skinny little tube and they'll expand to whatever size you're putting them over. And then they'll hold your dressing in place. So they're a nice thing to keep in mind. The other is the antiseptics to use. So the one that I put up there is Hibiclens. It's been around forever. They also make generic. It is a chlorhexidine, 4%. It has antimicrobial, so using it as a cleanser, you can buy it over the counter. So it can be used for showering or whenever they're using it to clean that. The other are looking for emollients that have benzalkonium chloride. Also has antimicrobial activity. So the Aveeno line puts it in there. So it's they're inexpensive relatively, and you can buy them anywhere. A couple of others are also available. There's multiple, but I pulled 3 off. Dermal is another one, and Oil-Latum. All have benzalkonium chloride in them. So keep those in mind. Managing the comorbidities. Again, I saw mostly diabetes, so getting their diabetes and the glucose control under control was a really important part of the treatment of the people I saw. Pain assessment, so assessing their sleep disturbances and then using appropriate medication to help them with sleep. You all know sleep always makes things easier to deal with. So non-steroidals are kind of the drug of choice for pain that they are using. Can look at opioids, but maximize your other options before going that route, if at all possible. Okay. Anything else you all talked about in general management? Who came and talked about it? Oh, Professor Brooks did. Anything else she mentioned? Okay, let's look at treatment then. So the foundation of most of the stages is going to be an antibiotic of some kind. Okay, Clindamycin is commonly used first. And Clindamycin comes in a number of different products. It does come in a gel, comes in a solution. The gel is going to have alcohol in it, which may be too irritating, but the solution is available and is probably better to use. So in the early to mild stage would be topical clindamycin. A lot of these antibiotics, remember, have anti-inflammatory effects too. So not only are you getting the microbial action, you also get the anti-inflammatory action. Also, you can use topical resorcinol. So chemical peels, resorcinol is a part of those. They are usually applied directly onto the area. They help work with new lesions and actually decreasing their formation or progression. Because they can be caustic, then there would need to be a lot of instruction on how to apply those. But they can also help with the pain. That one can be, it says it can be used daily and then tapered down to whatever will help maintain that effect. The other would be the use of intralesional corticosteroids. So here it is again, triamcinolone acetonide. There's, and Kenalog is, I'm sure there are generics now, but Kenalog was the one for a number of years. So monthly injections until the nodule resolves. Systemic antibiotics are, these we go with topical until we can no longer get the effect we want, and then layering in systemic. So doxycycline or minocycline. Remember, those have anti-inflammatory properties also. They're good in that way. And we use them for acne. You all talked about it in acne, I bet. Tetracyclines are usually the antibiotic of choice. An alternative would be go to oral clindamycin, but there are problems with that drug, aren't there? When we use it orally, what's the big problem? C. diff. So we usually don't want to go to it orally unless we don't have any alternatives. You'll see that it comes into like a second or third line. Okay. So that's the general of the mild. Anything that you were taught that would I left out or goes against what you heard? That's pretty much how I saw people treated in the family medicine clinic, very similar. Okay, so Hurley stage 2. So if you look back at Hurley stage 2 on the page, 2 pages before, that stage is recurrent abscesses with sinus tracts, scarring, and single or multiple widely separated lesions. Okay, so antibiotic therapy again, number 1, we want to control for secondary infections, odor, and anti-inflammatory effects. First line are the tetracyclines. So kind of start lumping acne, not that they're the same, but lump those together as first line. Typical course, see, is very long, 2 to 3 months. So here we're going for oral agents. Erythromycin and cephalosporins can also be considered. So broad spectrum. So here you see clindamycin shows up, but it shows down up as a second or third line agent. So it's clindamycin, rifampin. So you remember the things about clindamycin. What's the big thing about rifampin you need to tell people? Orange pea, yeah, orange everything. Orange tears, it'll color your contacts. Those are big. The other thing, what have I always told you about rifampin? If you start rifampin or you add something to rifampin therapy, drug interactions, huge. It's a huge inducer, very powerful. And this is one of the few times where you could see it used for prolonged periods of time. In other diseases, you often will just see it used for 3 days. But TB and this one, prolonged treatment. So think. That orange colored secretions ought to make that little red flag go up in your brain. It's like drug interactions, got to check it. Other antibiotics, Dapsone. This one has more modulation of the immune reaction. So what about Dapsone do you remember that you need to check before you treat? Sulfa allergies, anything else? G6PD deficiency? Then combinations of drugs, rifampin, moxifloxacin, so fluoroquinolone, and metronidazole. So what you see mostly is you're moving from fairly specific therapy in the beginning to more broad spectrum. So they're going after more, like your tetracyclines for broad spectrum, your quinolones, broad spectrum. Metronidazole, what does it go after? What would it be good that it would add to? Gram-negative and anaerobes. So here now you see the oral retinoids show up. Again, Soriatane, we talked about it yesterday, is the primary. It's probably the best of the retinoids to use in this situation. They're anti-proliferative. Remember we talked about it shuts down sebum production, oil production everywhere. So that's where it is adding to, and also an immune modulator. The other thing that shows up in stage 2 is the use of hormones. So what do we know about acne? When does it show up? When you're 3 years old? No, puberty. Okay, so people have often linked it to changes in hormonal. So use that to remember that it may be good to use oral contraceptives for the females. For the males, look at anti-androgens. You don't want to do those in the women. Okay? So the drugs down there, some of them should be familiar to you. Finasteride, where did you see that pop up? BPH, maybe? Okay. You never want to use it in women. Spironolactone. So it has anti-androgen effects. And then Tirone is a very strong anti-androgenic drug. So think about that for men. It's like Podron. Okay. Don't want them pregnant, don't want to give them to women. All right. The next page is stage 3. I am not going to test you on these. These would be really severe people. Unlikely you're going to be involved that much in their care, but I wanted you to have some information. A lot of this will be surgery, so it's going to end up in others. So if you go into surgical specialty, you may see these. So using both of these. They're also looking at starting to use the biologics. And so they're listed there for you. Humira probably was the one that was used the most early on, has good short-term data. They just published a 3-year long to show that it does have more long-term use as well. So probably the one to go to. Infliximab has a lot of side effects. You remember the one thing about infliximab that's a problem when you use it? So look at the end of that name. What's it tell you in terms of it's humanizing or chimeric, or it's more chimeric. So what does it do? What's the immune system do? Antibodies. So this is the one where we talked about if you use infliximab, you've got to use it with another biologic or another agent because of the antibody will start to chop into your effectiveness. So I imagine a lot more of the biologics will start looking at these because they'll look for other niches and other markets. Again, for right now, it's going to be in the more severe forms. But watch for it to creep in because the topicals are good, but they are, you can see, look at all the drugs you would have to take for just that. And these folks almost always have other diseases. Another big thing is that usually or at least the ones I have seen, of course I saw mostly through diabetes, are obese. So one of the other things we talk a lot with them is about losing weight, just to cut down on shear force. So I would look for these biologics to become more important down the road for this disease. And hopefully it'll work because it is a miserable, miserable condition. Other immunosuppressants can be used, especially if you've got a lot of inflammation that is part of that the person is experiencing. So look for recommendations for systemic glucocorticoids, or like cyclosporin could also be used. All right. Questions about those? If you see that disease, I would think multidiscipline. Who can you bring in to help? Because they really are, it's a difficult condition, but it's also a difficult emotional condition to deal with. And you see them frequently. So drawing in all the people who can help and support, I think is important for them. All right, let's take a break. We'll come back just a little bit before 11 and we'll pick up with the dermatitis.